Beyond the trip, beyond the haze, we're lighting up these shadowed waves. Ketamine dreams to...
Welcome back to Conscious Healing, Beyond the Trip, hosted by Dr. Jason Harris. Each week, Dr. Harris explores the world of ketamine and other psychedelics, uncovering how they're helping to treat mental health conditions and chronic pain disorders.
This podcast is intended for educational purposes only. The information shared should not be considered medical advice. Always consult with your physician or a qualified healthcare professional before making any changes to your medication or treatment plan. Please be aware that some of the substances and treatments discussed on this podcast may be illegal in certain jurisdictions. We do not endorse or encourage the use of illicit substances. Welcome to Conscious Healing Beyond the Trip. I'm Dr. Jason Harris. I'm an emergency medicine specialist with a passion for exploring the therapeutic potentials of ketamine and other psychedelics. In this podcast, we dive deep into the medical, psychological, and transformative aspects of these treatments. Whether you're a seasoned practitioner, a patient, or simply curious about alternative healing methods, join me as we uncover insights and stories that go beyond the ordinary. Today, we're diving into the after party of ketamine treatments. That's right. What happens after your treatment, and how can you make it work better? Ketamine isn't magic, it's medicine. And medicine works best when we support it with the right tools. So if you've had a treatment or you're planning one, this episode is your post-ketamine game plan. First, let's set the stage. Ketamine is not your average antidepressant. It's fast-acting. It works on the NMDA and glutamate, not serotonin. Some people, it can lift mood or reduce suicidal thinking in hours, not weeks. But ketamine is more like a door opener than a fixer. It creates this short window, a neuroplasticity window, where your brain is more flexible and more changeable. Like you've got a brief chance to rewire how you think and feel. It's the wet cement moment for your mental health. So the question is, what do you want to write in that wet cement? Let's talk about the big word in the room, integration. Integration just means making sense of what came up during the treatment and actually doing something with it. Think of it like a dream. If you just roll over when you wake up and forget it, cool. Nothing changes. But what if you journal it? What if you talk about it? What if you reflect on it? Suddenly that dream you had might shift your week, your mindset, your life. So let's get practical. Here are 7 science-backed, physician-approved things that you can do after ketamine to lock in the gains and keep building. Number 1, give your nervous system a break. Let it rest and recover. After ketamine, your brain's been on a roller coaster. So first, let's not schedule a high-stakes job interview the next day. Let's sleep. Let's hydrate without alcoholic beverages. Let your system come back online gently. Give yourself permission to pause. Remember, ketamine is like rebooting a computer. Number 2, journaling. Even if you hate to write, because you don't have to be Shakespeare, just write what came up during or after the session. What did you feel? What did you see? What did you learn? This helps your brain consolidate the experience, literally shifting it from a psychedelic moment into actual cognitive change. Number 3, mindfulness and breath work. You're in a sensitive, open space. Mindfulness, even 5 minutes a day, helps train your brain to notice what's happening without judgment. Try box breathing. Breathe in for a count of 4, hold your breath for a count of 4, breathe out for a count of 4, and hold your breath for a count of 4 and repeat. Do that for 5 minutes. Or you can just sit quietly and watch your thoughts go by. You're building the muscle of awareness, which is exactly what ketamine is enhancing. Number 4, therapy, especially in the first 48 to 72 hours after treatment. This one is gold. Studies have shown that therapy during the neuroplastic window is way more effective. Your brain is literally rewiring yourself. If you have a therapist, book a session within 2 to 3 days post-treatment. If you don't, this is a great time to start. Find a therapist. Even one session can anchor what you've learned. Number 5, behavioral activation. Do the thing. Ketamine gives you a lift, but you've got to use it. That little window of motivation. Act on it. Go for a walk. Call a friend. Take a class. Do the thing your depressed brain wouldn't let you do before. Motion creates emotion. Don't let the spark fizzle. All right, number 6, feed the brain, literally. As we discussed previously, ketamine works on the glutamate and NMDA receptors. They're hungry little beasts. You've got to fuel them with protein, omega-3s, and B vitamins. This isn't snake oil, it's neurochemistry. Sardines, walnuts, and leafy greens, that's ketamine's dream meal. And finally, number 7, stay connected. Isolation is depression's favorite playground. After ketamine, people often feel clearer, more open, but that can fade. So text a friend, join a group, talk to other people who've had similar treatments. You don't have to do this alone. We've gone over the 7 things you can do. Here are the big ones. Here's the no-nos, the things you don't do after a treatment. Don't drink alcohol or use recreational drugs, including marijuana, right after your treatment. Not only is ketamine sedating, but also alcohol and recreational drugs, including marijuana, are sedating. They'll undo everything we just did and that you just paid for during your treatment. So just don't do it. Don't isolate or over-intellectualize the experience. Don't expect ketamine to do all the work. Think of ketamine like a key that opens the door to the gym, but you've still got to go to the gym and lift the weights. Here's the major truth. What you do after your ketamine treatment can make or break the long-term benefits. You're paying lots of money for these treatments, so do what you need to do to get better. This isn't about perfection, it's about intention. So ask yourself, what kind of life do I want to build now that the fog is lifted? Because ketamine is not the finish line, it's the starting gun, and your healing journey deserves to be yours. Stay tuned next week for our next episode where I'll discuss S-ketamine, also known as Spravato. This podcast isn't medical advice. It's a conversation, one that's evolving. So talk to your doctor, ask the hard questions, but remember, your provider may not be up to date on the latest research or might be closed-minded to the use of psychedelics, even though the science is there. Stay skeptical, but stay open-minded because sometimes the most healing paths are the ones we nearly forgot. Thank you for joining me on Conscious Healing Beyond the Trip. I'm Dr. Jason Harris. Until next time, stay curious and stay informed.